Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Hello, everyone. This is Combos from the Couch. I'm Nicolette Lianza, and on today's episode, I'll be talking with nurse practitioner Nicole Butella about the importance of infancy and early childhood mental health. So, welcome, Nicole. Great to have you on.
Thank you. Glad to be here.
I feel like this topic is so important because I feel like oftentimes this might be ignored, ignoring like infancy and early childhood mental health, because I think a lot of times it's misnomer of thinking, oh, what mental health issues could be coming about at that young age. But we know for a fact, yes, there are. So I'm really glad we're having this conversation today.
Yeah, same.
Tell us a little bit about yourself and what led you to a specialty in infancy and early childhood.
Yeah. I really just wanted to help my community do the most good, provide services to the populations that need it most. It was really evident early on, my parents having challenges with my youngest brother. He's about 18 years younger than me, but he was born deaf and then later diagnosed with autism spectrum disorder, amongst another array of diagnoses. And as I look back, I can't imagine being my parents trying to navigate that healthcare system in a small rural community to help their son. And at the time, I was going to college taking generals, and I wasn't really sure my path in nursing. But since then, I've had and stood by friends and family through their own challenges with accessing mental health services for their children. And now, being a nurse for over 20 years and working with different populations of people ranging from 0 to over 100, I've worked in many specialties. So, when I started my journey as a nurse practitioner, it was clear the high rates of people that were struggling with chronic physical illness and mental health issues as well. But there's few services to refer people to for integrative care, combined care, or mental health care, and many didn't meet criteria for specific services. And so I think that can be really confusing, that criteria word. So no sooner did I finish my general practice or family practitioner program, and I went back to school for psychiatric mental health, working in so many roles in medication management and really just feeling the barriers that patients face just to get to me. And then sometimes that's just part of the puzzle. Then they might have to go somewhere else and they're pushed around and have to jump through all these barriers. I learned a little bit more as I was working in a clinic that specialized in treating neurodiverse disorders of our youngest population. And that's kind of where I discovered DC 0 to 5, or that diagnostic classification of mental health and developmental disorders of infancy and early childhood. And it just took me back. And I thought all my years in nursing and then my training with through the lifespan and mental health, I thought, how didn't I know about this sooner? And what can I do to help people get access to this?
That's a good lead in. Tell us more about your certification in the diagnostic classification.
Yeah. So I feel very fortunate. I had a supervisor that she was certified to be a 0 to 3 trainer. And that's 0 to 3 is where DC 0 to 5 actually comes from. It was originally DC 0 to 3, but she provided training through our employer and through the Minnesota Department of Health. So I work out of Minnesota, and it was a combination of self-study, reading, lectures, presenting cases, and being present with other clinicians presenting their cases. And it was about 13 and a half hours of face-to-face training. We had to actively work with the 0 to 5 age population. There were multiple mental health professionals, from social workers, therapists, psychiatrists, psychologists, and just one other nurse practitioner. But there was probably about 30 of us in a class at a given time. And the training was provided through Zoom. So I think that really increases the access to these trainings. And DC 0 to 5, because you are assessing and diagnosing, requires a scope of practice where you're able to do that.
So you definitely come with the experience to really help this vulnerable population for sure. So, what are some of the early warning signs that parents and caregivers should watch for that might indicate mental health concerns in babies and toddlers? And even what does good mental health look like in young kids?
Yeah. I think sometimes I'm a nerd and I like data. I think, 1 out of every 10 kids under the age of 5 struggle with mental health issues. And that's just the data that we know, right? Not everybody gets
Mhm.
screening and not everybody that has a mental health issue we're aware of. So those numbers are low. So what we do know, warning signs in young children are often noticed as delays in developmental milestones. And again, big words, right? How do we understand that? And that's just breaking it down to, like, children are expected, or we know that they are on a developmental kind of trajectory. We crawl, walk, eat solids, talk at certain ages. But that can be different for children depending on maybe if they're premature. Their developmental age might not actually line up with their chronological age. So I think it's important to know that DC 0 to 5 can be really helpful for that, to help people get the right diagnoses and then to get the treatment. It's incredibly important to follow up for regular appointments and well child visits with your pediatrician or your primary care provider. I just really can't emphasize enough the importance of establishing care so your providers know you and your family. They can provide more thorough assessments over time because they're going to know how your child is progressing and have met them before. At that time, if there's delays in development or concerns such as excessive crying or what we know as purple crying, it can warrant that discussion with your provider. Myself, I wish I had made more follow ups with my own son. I carried a lot of guilt with his colic and crying, and especially with the misleading information. Even me as a mental health professional read online, and then I'm worried about how is this going to affect his emotional and mental health as he gets older. And there's some theories with the crosswalk from DC 0 to 5 with like excessive crying to could this result in oppositional defiant disorder later? But there's a lot of missing information there. So
Okay.
there are some crosswalks to go from DC 0 to 5 to DSM that are interesting, but we can intervene, right? So we
Mhm.
can do something. But again, just to follow up with those providers, get that reassurance, the support, and the resources that parents need. I myself have been involved with infants that have had food allergies, or an infant that had a small hair that was like wrapped around a toe, cutting off circulation. And
Oh,
these kids come in, and the moms are like, I just don't know. They're fussy. They're just not, they just have that feeling something's not right. And you feel for these moms because not everything is easy as removing a hair from a
right.
toe, but that's really why it's important to keep
Yeah.
these regular appointments so that parents can get the right resources and support that they need. The CDC has great resource for tracking milestones. They even have an app for your phone or mobile device. So I think that's can be helpful if people are like, are we tracked? And then 0 to 3, or the DC 0 to 5, also has great videos and information for tracking developmental milestones, because it isn't until later on when kids are maybe over the age of 5 that you might be thinking more like mental health versus developmental health. And
Mhm.
that's when we'll start looking for things like what's changed with sleep. Are they having a hard time sleeping? Are we expressing frequent fears or worries? Consistency or constant reports of like physical or health ailments like stomach aches is common with anxiety. The regression in development or going backwards with those milestones. And then maybe they start not enjoying things that they used to, and not just aging out of certain things that they used to like that were age appropriate, but really just not seeming quite their excited normal self. And then of course any issues like that have changed. Now I'm eating differently or having trouble with eating, or their mannerisms are slowing. There's just a slowness about them.
So, how does parental mental health affect infant and toddler emotional development?
Yeah, so parents, I think we never put ourselves first with our kids. Our kids always come first. So I think it's interesting that like 18% of parents, again, that we know of that have been screened have mental illness, and almost 4% has serious mental illness. And so, taking this data from the US Department of Health and Human Services, 65% of parents and guardians, they're feeling lonely compared to 55% of non-parents. 3 of every 4 parents are concerned that their children will have anxiety or depression. 33% of parents report high levels of stress compared to 20% of other adults. So I think that just even the data shows the amount of pressure that parents are feeling and the expectations and their own worries about maybe experiences they've had with friends or family with kids that have had mental health challenges. And children that have parents with inadequately treated mental illness are more prone to cognitive, academic, and personal struggles. They're 4 times more likely to have poor general health and 2 times more likely to have a mental, behavioral, or developmental disorder. Just to put it in, what does that look like if parents have poor mental health? And it really is. It's that low motivation. It's the lack of an enjoyment in normally enjoyed activities, like being excited about your children meeting those milestones and being able to experience that with them. The low energy, poor concentration, poor sleep. These all contribute to further decline in physical health and cause problems, again, with just being present and engaged. It's really important when we think about attachment and how parental mental illness can maybe delay or cause problems with that
Right.
attachment. And that goes for both parents. I think we forget that moms and dads are involved in this, and the infant and the child as well. And that first 3 years of life is the most important part of that brain development.
Yeah, I don't think we can underestimate that right there, just how important it is for brain development. There's sometimes hesitation around medicating young children for mental health issues. Could you discuss when medications might be appropriate versus when other interventions should be tried first?
Yeah, so I think that's a tough one. I don't think any of us want to have our children or even ourselves take medicines if we don't need to. So, medicine should never be a first line treatment with children. It really shouldn't be for anybody. If there's other things we can do, modifications and behaviors or lifestyles, we should do that. And we don't want to use medicines for the wrong reason. We're not just making children sleep or that kind of thing. We want early intervention. So that's what this DC 0 to 5 is about. The earlier we can identify the problem, the earlier we can assess, diagnose, and find the right treatment. Every state has early intervention supports. And in order to receive those supports or services, there's certain eligibility requirements. So going back to the beginning where we were talking, lots of challenges with the diagnostic codes that we use for billing, and then those might not be supported by commercial insurance. Even myself trying to advocate more, getting involved in the legislative process and learning about that, because we really need to figure out how can we increase services to this population and decrease access to them or increase access to the
Right,
services.
right.
In the states and counties people live in, there is funding available. So it's always good that we need to start this process and then reach out to our counties. But every state also has early intervention supports, but they're kind of all named something different. So that was something that was new for me as I was looking up information. In Minnesota, it's called Help Me Grow, but in other states, it could be called First Steps, Early On, Sooner Start. In Minnesota, we can submit referrals right online. And usually, what happens after the referral started is the child's local school district will contact to schedule developmental screening and evaluation. And most of the time, we think about DC 0 to 5 to get a diagnosis, but then in order to get certain services, then we have to have an intensity scale or instrument that really supports the level of care that people are being referred to. And that's where we get into what sometimes people here called are the EXI and the CASI. And these stand for the early childhood service and the child and adolescent service intensity instruments. So early is 0 to 5, and then the child and adolescent is 6 to 18 years. They require a certain training. I completed my training through the American Academy of Child and Adolescent Psychiatry. And it can be anywhere from 6 to 12 hours to complete the training. And I really only mentioning this because recently a friend and colleague reached out and had a patient that was really struggling with some challenges. And it's not that we can't get a diagnosis, but in order for them to get a service, somebody had to complete this intensity
Oh,
scale.
wow.
And
Okay.
there were providers in the area, but in order to get in to see them, they would be waiting 6 months. And
Oh,
so she went ahead and on her weekend, on her own time, completed the training so
wow.
that she could help one
Wow.
person. But it'll go further than one person. It's an impact that we can make, but
Mm,
there's barriers.
yeah.
So again, it's just importance of behavior modifications, therapeutic interventions. They're always the first line. There are cases that I think about that medicines might be better. I've treated kids uh, as young as 2 years old with medicines. And that's because the symptoms are so severe. I think about those kids with ADHD that have hyperactivity and impulsivity that puts them into really dangerous situations. They don't really have that space to think yet, and it leads to injury. And so, if that's the case, then medicine would outweigh the risk. So the benefit would be better, but it's not for everybody.
Any other insights you'd like to share?
Yeah, thank you. Thank you for having me. I think it's helping people be informed. Unfortunately, there's a lot of stigma surrounding mental health, especially with this push of earlier diagnosis equals earlier intervention equals better outcomes. But I don't think people really understand that. And so I think parents should really take away that with DC 0 to 5 and diagnosing and treating our younger population isn't permanent. That diagnosis doesn't have to stay with them forever. There's, like we talked before, the crosswalk where you can go DC 0 to 5 to more of the DSM or adult diagnoses. But that's really only if the symptoms persist and continue to cause problems in their everyday functioning. But really, the whole hope is to get earlier treatment to prevent this kind of ongoing worsening of
Mhm.
mental health challenges. So, diagnosis doesn't mean medication. And I think that's just really important. Not everybody that comes into my office has to have medication. It can mean education, it can mean occupational speech, individual, or even family therapy. It means being informed and
Mhm.
really providers taking that step to provide the information so that parents and families can make a shared decision with their treatment team. Seek help. If something isn't right, check in with your primary care pediatrician. Be persistent. Ask for referrals for early intervention. Consider education and parenting classes. There's often resources provided through I think about Minnesota Department of Health, where I completed my training, but there's also free resources for our common people through state and county. And then again, for mental health professionals to just be informed, get the training, get some CUs.
Definitely so important. My gosh. Thank you, Nicole. Thank you for informing us and sharing your knowledge about this, again, very vulnerable population of these young children, infants, and their mental health. So thank you again.
Yes, thank you for having me.
I'd also like to thank the team behind the podcast, Jason Caden and Juliana Whitten. Thank you for listening to Converse from the Couch. Take care, everyone.